Yes. Punya course ada tak? So you guys know what it is. Kalau I cakap pasal mini-tax, CBD, right? So now, just if you remember 2 weeks, 1 week ago, not even 1 week ago, I posted in the WhatsApp group. So I cannot put it, the forms in here because it's too big. So please refer to that forms, right? So for program assessment, there will be many texts, CBD, case-based discussion, procedural based assessment, multi-source feedback assessment, and then there will be a satisfactory progress of the research project or dissertation, satisfactory participation in the fellowship courses, satisfactory logbook entries, summaries, and skills assessment certified by the supervisor. So before you go for your end of posting assessment, you have to have this. Right? Right. So the work-based assessment, it is 6 monthly assessment within each posting. So kalau you buat setahun dekat HKL, then you kena buat 2 kali lah assessment. Because this is 6 monthly. If you do it yearly, then it is quite late detect problem students. Right? So you have to do 6 monthly. Within 6 monthly, you have to have at least 3 mini-tax, 2 CBD, 2 procedural-based assessment, and 1 multi-source feedback. The reason why kita kena ada more than 2, minimum 2, 3, because satu tak cukup. Because we need to compare whether you are getting better or you are getting worse based on this assessment. Right? So mini-tax, I think everyone learns hear about mini-tax. Mini-tax ini is a method to observe you to provide a good clinical care. Right? The supervisor will need to observe you. Right? Sama ada you perasan ke tak perasan ke? Right? Will observe you during a consultation with your patient in a ward or in a clinic. And the most important component is in any this office assessment is feedback. The supervisor must give the feedback. Okay? So it depends, tengok macam mana supervisor akan tengok you ambil history, physical examination, sama ada how you approach the patient during clinic, masa nak ambil consent. So the supervisor, the thing will take around 15 to 20 minutes. It's very short, right? Berbanding dengan CBD, CBD is a discussion in reasonably formal setting. So you need to be assessed by the supervisor with regards to anything, probably how you manage a patient in the ward, how you manage a case when the meeting going to discuss with your supervisor, right? Because we have to assess clinical judgment, decision making, and the application of medical knowledge in relation to patient care in cases for which the BNE has been directly responsible. We want to see this and to test higher order thinking and synthesis and follows assessors to explore deeper understanding of how clinics compile, prioritize, and apply knowledge. So, purposely, work. Minimum, and it takes around 50 to 30 minutes, and at the end of it, dalam orang tu dia ada assessment to provide immediate feedback to the trainees. Okay? Procedural based assessment. These are the assessors will come to assess whether, let's say, we are in fellowship present of mind on how to do breast surgery, how to do the thyroid surgery. So to assess your professional skills in the range of specialty procedures or file of procedures during routine surgical practice. Kadang-kadang supervisor tak boleh nak tengok semua. Kita datang in the middle, nak tengok how you will handle the recurrent and internal. So that is also part of the PDA. Right. So with regards to PDA, these are the requirements that is needed. Right? You can take picture from this, but we decided mastectomy is no more. Everybody should know how to mastectomy, but nipple or skin sparing is added as one of the things that you need to do. Right? Okay. Reminder. This assessment is the training initiative assessment. Jangan biarkan, because we have experience when we handle this for master student. Jangan biarkan supervisor yang cari student untuk buat assessment. Please, supervisor, remember this. It is their responsible. They should find the supervisor, not the other way around. Right? So if you tak buat, sorry to say. Right? Kalau katakan ini biasa terjadi, akan terjadi. Katakan bulan 5 ni, bulan 6 ni nak masuk nak ambil zakat posting. Tiba-tiba dah masuk bulan 7. And then you dah masuk posting lain, kan? Kata you tak boleh minta balik supervisor sebelum ni. I nak buat ni KSN sini. Sorry, sudah terlambat. Right? You cannot, because I need to remind this again and again, it's only for that specific period. You tak boleh, aku kata, backtrack every day. Right? And supervisor, tolonglah jangan baik sangat, kesian, no. Alright? Because what is considered as a paid fellowship assessment. Betul. Okay? Multi-source feedback is the onus for the supervisor. Formally it's called 360 assessment. So you use the number of multidisciplinary raters to score a trainee against the number of dominants mostly concerned with attitudes and behaviors. So probably the best if we do through, you guys do through the Google document, and you can have, kalau satu unit tu, okay, you can get an MO, houseman, to assess this fellow, this student, and then specialists, colleagues from other, like oncology, radiologists, to assess whether there is an attitude and behaviors. Right? Logbook. Please treat this as your professional resume. Again, I don't have to remind many times, get it validated. Because you tak validate how many, berapa page pun you letak, I tak tahu ni betul ke tak. Ni plagiarism ke, apa ke, right? So a logbook is not a formal assessment, but a log of all operative procedures you have undertaken and the level of observation required on each occasion. So be serious on your logbook. Alright? Okay, this is the this is the current how you should put your this is according to the national curriculum. Right? For masters, which I think is also need to be in terms to the fellowship program, whereby there is level 1 to level 6. So how you should answer, how you should it is within that you can have MRN number, patient's name, diagnosis, procedure, and complications. please write down your communication, be honest, and it's better if you say how you manage your communication. So towards the end, we want to see. Okay? Kalau kita tahu communication sama je, maknanya fail lah. We keep on having complications, right? And competency level, right? The last row yang kotak kat bawah tu adalah the summary. Alright. Compulsory courses. In KB, we have decided these are 5 compulsory courses per year. And HKM, HTTM, HPJ, and UMMC will take this for probably for the next 5 years, maintain this, right? UMMC will take on oncoplastic breast surgery workshop. UKM will take ultrasound and thyroid workshop, adrenal workshop, and sentinel lymph node workshop. Why I say I think it is better to maintain like this because currently banyak drug company came macam semalam, so they want to help out. They have an academic fund, so they want to help out. So when they come to see me, they say they want to involve. I've already told them to go, want to do sentinel workshop, you approach this guy. They will do. So it's easier that way. Every year will be the same. Probably time pun what I can foresee for our breast fellowship ni kita kena ada takwil untuk setahun lah. Senang nak tahu when is BFS, when is the MDSC, right? Police of surgeon and these compulsory courses. With regards to the isu pembayaran, I tak tahu, I leave it to Esport University kena bayar lah. Tapi kalau untuk ATM, probably ada fund lah kan. Alright. Oral presentation. Candidates are required to do oral presentation at 2 local meetings.
Try see, okay, right?
Which is MPSC.
How to see?
And police of surgeon meeting. Poster presentation tidak dikira. Okay. And one international organization, contohnya ASAS, ataupun benda-benda yang lain yang berkaitan lah. Banyak. Kita mesti macam Asia dah pergi tu. Okay. Sebanyak 3 tahun, 1 je. Research and publication, to publish one research in medical journals. I think this is include medical case report. Case report is accepted, right? Asalkan publish. Kita tak letak lagi kena Q1 ke apa tak. Kalau Q1 tu ni all. Right? So pada publications, publication rate, duit, jangan tanya komiti Itu I tak berani nak jawab. Kalau you nak, you tanya Mr. Chair. Alright? And please, we do, I don't know, can we accept audit? Yeah.
Okay.
Audit which is published in journals. Alright. Okay. Okay. Bila dalam masa setahun 6 bulan, you need to have end of Muslim assessment. Alright. So you have to prepare everything which I have shown you just now. Okay. Kalau tak cukup, it is considered as a field assessment. So at the end of the assessment, the supervisor, at the side need to assess whether this candidate falls into one of these 3. First, whether satisfy all training competencies and is allowed to proceed to next posting. 2, atau sama ada dia ada minor inconsistencies in their training that needs to be improved in the next posting. Benda ini dipanggil as a reminder for the candidates. So, yang ketiga, dia ada major deficiencies in their performance and has failed the posting. This constitutes as warning. Right? Okay. An outcome of minor inconsistencies in training competency will be accompanied by a reminder. So, head of service would write a letter to you saying that this is a reminder that you have not been performing well. Right? An outcome of major deficiencies is accompanied by a warning. Okay, you akan dapat surat daripada head of service. Head of service ni banyak surat yang dikeluarkan. Tak tahu warna apa je surat tu. And this will be discussed also with the fellowship trainers committee for further action. Surat dah memang dapat. Tapi sama ada nak buat apa-apa action ni kita tengok juga lah. Bukanlah kita ni apa, just nak to document everything. Trainees are reminded that an accumulation of 2 reminders. Reminder kena dapat, next posting pun reminder juga. So this will result as a warning. Okay? And an accumulation of 2 warnings will result in a recommendation for termination of the program. But this is pending for the discussion. Bukan automatic, but pending with the discussion. Okay? Alright. Exit exam. Okay. Exit exam will be conducted at 3 years at which is at the end of the program. This is a viva examination conducted by exam board committee. The examination is format is as follows. Dia ada 4 table. The first table is thyroid, breast, parathyroid, and adrenal. This is a structured viva testing on critical thinking, on rather, right? Bukan level undergraduate, bukan level masters ya. Ni level nak jadi consultant. And must fulfill the formative assessment requirements before sitting for exam. If fail to complete the assessment before exam, right? You fail the assessment and you need to go for exam, complete the exam, this is considered as first attempt. Okay? Considered as an attempt. I will remind you for your fellowship, you are allowed to go for 3 exams. First time fail, boleh lagi, 3 kali. Kalau you fail kali ke-3, you can still write a letter, you can still sit for the exam, tapi kena write letter to the head of service. And then if it's service akan disahkan dengan komiti. Awal dalam. Kita tak cakap sampai bila, tak ada. Kalau you fail banyak kali pun, boleh je lah surat. Write letter. Right? Because kita dah train you all, mungkinlah. Okay? It is probably is a single multiple case scenarios, probably case-based discussion. Dalam satu table katakan pathology, kalau katakan breast, it must include surgical radiology, surgical pathology, operative surgery, and toxicity issues on managing given cases. What we want to have is to have a candidate that is able to formulate, create ideas, good thinking process, not only to recall knowledge, right? But we don't able to apply knowledge patient yang unable to apply knowledge for critical cases that we discussed. So the examiners will be among us. They will be selected by the head of program, head of service. from KKM and also universities. There will be one from UKM, there will be one from UM, and then the rest will be KKM. Right? The results will be announced after Board of Examiners meeting because kadang-kadang kita buat exam ni dekat universiti, kadang-kadang kita buat dekat KKM. So budget ni, because sekarang ni isu duit kan, kalau kita pergi exam MRCS, bayar berapa ribu? Ribu-ribu kan? Ini I punya suggestion. Kita dah bring forward dah. Baik kelatihan pun dah setuju. So minta ada bangkangan ke RM200 untuk sekali duduk, sekali pergi exam. This is to, because kalau you buat kat UKM, I tak boleh makan banyak UKM tau. Because towards the end, I kena duit wallet I. I think same dengan Anita kalau dia buat dekat, because susah. I nak testify because this is bukan program UKM. I hope you guys understand lah. We are going to impose this on RM100. Alright, permarkahan, sistem permarkahan. You have, okay, let's see. Okay, listen. You have 4 tables, right? Each table you have, katakan you see for pathology, ada 4 examiner akan dengar you menjawab pathology. So each pathology, pathology lah, soalan thyroid. So ada 4 examiner akan dengar you jawab soalan thyroid. So each will give individual marks. So dalam permarkahan diorang akan bagi sama ada you fail, borderline, pass, good or excellent. This is a close marking system. Kalau total you more than 40 and above, you pass for that table. Kalau 38 to 40, fail, borderline. Less than 38, fail. Okay. Alright. So sekarang ni imagine ada 4 table kan. So each table kita kena tengok pula. Kalau you ada satu borderline, probably you need to discuss lah. Board of examiners akan discuss sama ada you ni kena bantu atau tak. Perlu ke tak? Then I think it's better to see that all your record the last 3 years. Buat during tu dia ni kandidat yang hebat ke, kalau hebat mungkin kali ni dia exam dia ni panic. So kita consider that. Or 2 or 3 borderlines, biasanya kita akan minta for revival on the same day. Right? 4 borderlines or failure in any station is considered fail for the exam. Ada clear right? Right. Now, kadang-kadang dalam masa 3 tahun banyak ada masalah deferment. Right? Deferment maknanya penangguhan. So a trainee is allowed to apply a maximum duration of 6 months. This may be taken continuously or at separate times. This period will not be counted within the compulsory training period of 3 years. Tak dikira. The training must inform and formally write letter to head of service and the BPL of a planned deferment at least 3 months before deferment, and need to inform the clinical supervisor at the attached training hospital. Once the application is successful, the trainee must report to the hospital assigned by the Ministry of Health Training Division during the period of deferment. Right? Okay, kadang-kadang dalam 3 tahun ada yang tiba-tiba nak keluar daripada program. So, trainees who wish to withdraw from the program, first minta pandangan dulu sebelum isi borang. Okay, jumpa head of service, saya nak keluar, saya ada masalah bla 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 ni, and bagi tahulah kenapa. Berbincang hati ke hati, berbincang juga dengan supervisor, right? Dia, kita orang kalau boleh tak suka, you dah masuk program A, tiba-tiba nak berhenti. Because seboleh-bolehnya, we want to help. We want to help you to finish your program.
Prof, cara saya minta, walaupun berbincang hati ke hati, tapi it will solve the problem because you have signed the contract. Means that if let's say you wish to terminate ataupun nak withdraw from your program, you need to pay 600K. So kalau hati ke hati pun tak cukup tak. Mungkin I boleh accept, tapi you need to pay to the government 600 or 700 now. Is that 700? I say that 600K you have to pay. So dulu 50,000, now this is 600K. You hati lagi, okay, one is no problem, tapi you need to have money to pay back to the government. Alright, so with that, let's say from the very beginning, you decide yourself, betul ke you nak enroll into this program? Jangan sampai separuh jalan, alamak, I tak boleh, I sakit, I did. Then you have to pay. Okay.
Alright, so despite that, you still want to, then you buatlah surat kepada head of service and your MOH. Okay, universiti dia ada tata cara dia sendiri, I'm not going to highlight it here. So that's all. Any questions? I might not able to answer. Probably the rest of the trainers can help me to answer questions. Yes. That's why they have not decided the date yet. We would start. We will discuss dalam WhatsApp group. Then the course, COURSE kan? Bukan COST kan? Okay.
That is not our level like COSE. Courses. Would that imply to the first year? Because most of us they live in July.
Benda ni semua berkuasa 1 Julai.
This
thing all within 3 years kena complete. Faham tak?
okay.
So kalau first year you macam tu dah nak naik second year kan?
Dah second year.
Seboleh-bolehnya cukup dah completekan semua.
Seboleh-bolehnya lah.
Itu yang malas tu. Dia main ayat.
Memang boleh macam buatkan Prof kan?
For me, because I will be going in October. For my other, I'm speaking on behalf of my.
Those who are going abroad,
July.
you can just go to the oral presentation. You can just internationally register.
Of course, sponsors.
Cost apa? Kita boleh pertimbangkan, but try as much as possible fulfill. But you are macam the last batch yang tak all kan. So kita boleh pertimbangkan, but try as much as possible. Itulah bulan depan SPL ada buat something. You have to enroll.
Okay. This is why we would want to know this.
But assessment semua je
One thing about regarding the assessment, so we need to ask our first year to feel like our
Gimana? Yang saya terbayar dah. Tadi nak tanya.
Prof nak tanya.
Ya.
Prof nak tanya. The oral presentation group is for 3 oral presentation for 3 years.
Ya, dalam 3 tahun.
Okay. So we realize that most of the oral presentation they will accept for the research, short research and whatnot. So for 3 research in 3 years, is it feasible? I tak tahu. That's what I'm asking.
It's within 3 years.
3 years,
Ah.
three oral presentation, which means 2 of the.
Maknanya, okay. You can buat research satu. Lepas tu probably you can you buat case series. Kan? You within itu, you make interesting case series. Combining best, katakan daripada hospital Selayang kan, right? Or Kuantan, okay? Case series, and then publish, and then present an oral presentation.
Because nowadays you realize that most of the oral presentation, they accept short research and whatnot, something like that. Like a case series, case report is difficult to present an oral presentation. I don't know. That's what my opinion lah.
Nanti ada komen apa tak? Ya, Aisyah.
Sebenarnya kan, research bukan semestinya research molekular ke, there's something called implementation research, which is going to be very useful for everyone in a developing health system. Okay, so implementation research, you will be able to reduction in SSI in and this is also for the trainers. Because what the trainers can do, because you are working the research, right? So your research doesn't have to be case series, case report. It's a waste of time. Honestly, it's such a waste of time. Those things you can do during the discussions in this meeting. It's very good. The case discussions we have is fantastic. We learn a lot of that. But for your research, you boleh buat something macam kata trainer apa, Mr. Hussein nak buat something kat dia hospital. Dia nak buat apa? Improve apa? Improve mengurangkan SSI. You are research there. But how to do the research? You need some training. Actually, implementation research is really upcoming now. You know why? It's not extractive research. You know what is extractive research? You buat satu dua case, lepas tu bilang, tak ada balik semula kepada community yang you research. But if you do implementation research, you actually do something, you improve your service, and then you also publish. So that is something I think that the trainers especially and the trainees may want to think about, so that you whatever research you do berguna untuk you punya hospital.
Okay, if I may add, CK, with regards to presentation to disease, it depends. Senang dan senang juga daripada jadi, one. Number two, I'm not quite sure the committee. Kalau sekarang ni ada banyak poster presentation. It's not just poster you letak dari tu. It's poster presentation, you have to sign. So do you accept poster presentation? Dia orang lalu. Dia present, dia orang lalu, like maybe about 5 minutes macam tu, you present your poster. Do you accept that? Yeah, do you the committee accept to as oral? Boleh. That one is easy. Yang tu easy. Yang siapa buat hari tu? Safuan ISW. Safuan buat kan? That one sekejap je. 5 or to 7 minutes. Oral poster. That one is very easy. Poster discussion. So bila you register for conferences, you book that one. Tapi for oral poster tu, it is not case reports. It is still a research study, and it is not retrospective study juga. It is still proper research, tapi yang straightforward. You all buat banyak sebenarnya buat banyak research sebenarnya yang clinical punya. So you can present that one. Even you can guna you punya masters punya dissertation untuk present. Kalau tak ada sangat lah. I mean the best is still present juga in the best. Still because you are in the program. Okay.
Okay, I sebut tadi, actually, discussion dia ada prepare, jangan cakap pasal people.
No feedback means that highly satisfied.
Right?
No feedback, no.
No, I'm glad I got opinions here. my opinion regarding the oral presentation, because you mentioned dalam requirement tu, ialah you need one national and one international presentation and also publication. So, I don't know, this is my opinion. I think, even though we kata kita nak ada dua oral presentation, tapi it could be the same study you are doing. So I think we should allow the same paper ataupun the same presentation yang you present dekat national can be also presented dekat international conference kalau begitu. So jangan fikir bahawa you kena ada dua tiga research yang you kena ni.
It's not ethical actually. Unethical.
National level.
Macam ni, kalau in the same study, you tak boleh present the same thing. You boleh present your preliminary result in the first, apa ni, conference whatever yang tak ada interim result. And then once you have completed, you will present the same study again, but the full result. That is enough.
Maybe one is like 20 pages, the other one.
As far as I know, you can actually present the same study, but in a different way, in both the local and the international is separate. So, tapi international kalau you dah present something, you cannot present again in another international meeting.
Yalah, kalau kita international, yes lah. Tapi kalau kita present dekat Malaysia, Brazil, punya course, I think why not you bring the same thing to the international?
Kalau nak buat macam
Kami abstract kena tukar. Abstract tak boleh sama.
tajuk bukan sah.
Tak boleh sama.
Yes.
Difference the tajuk.
Correct. Dia speaking. Satu is result. Satu you find something else. Tadi you decided banyak. You study satu orang. You get one result. Tapi you can, people result subset analysis. So that one can be done. So itu yang satu study buat satu report. Dia buat explain other things.
Actually, one study you can.
Okay. Thank you.
Okay.
Oh, okay, bro. Thank you, bro.
All of this is going to be implemented from 1st July, right? We need some
Can
keep this,
change and open.
to keep this in physical form is going to be
Put this
complicated
up.
because number one nanti hilang, number two kita tak tahu dah hantar dulu apa dah sifat and all that. And the worst thing is when it's time to do your apa ni,
What? So orange.
end of actually it's just
But you got them
going
open.
to something ada masalah.
There's nothing on the screen.
Masalah.
No, no, that's desktop 2, desktop 3. Apa, you go into presentation mode, it will automatically open.
Report and everything in basically the thing is we're going to use the MOH punya Google File. Okay, so you decentralize, you can isi do all those assessments, and you have to digitize them, and then you have to actually upload them into your file. Okay, so we have KKM punya email which is called BNE/KKM@moh.gov.my. Okay, within that we have access to the Google Drive. Within the Google Drive, there will be a folder called BNE Play Me, and within that there will be each of you plays folder. So what will happen is we will allow each one of you to have access to your folder for you to upload all your assessment forms that have been certified by your trainer. Okay, once that has been uploaded to the folder, then we will keep that and actually try to figure out how to log it. We can take it out. Okay, and then all this can be accessible to your trainer and by yourself, not by anyone else. And then when it's time for you to either move to a different place, the subsequent trainer will be given access to your folder to see how you have progressed. Okay? And of course, when we are doing the exam, prior to any assessment, and anyone who is going to be your assessor, who will need access to this, will be given. So we will try to implement this, but it seems like I need to go find someone. Yeah, jadi belajar the things for Sudah. Anyway, so it is like that, right? So we have a centralized folder online where you don't have to
upload all your digitized assessment form.
That's normal.
In fact, if we can, maybe we will try to convert the multiple feedback into an online multiple feedback so that one can be done, but can rest you do manually and then do us.
See,
I think we make 30 to we have alright.
Alright, so just a reminder, there's actually a feedback Google QR code in the announcement in WhatsApp, so that you need on this to fill it out. And so the next talk will be by Dato, Dr. Ini, BNE Surgery Malaysia, past, present, and future.
Assalamualaikum. Very good morning. So sorry because I have to swap my lecture with Miss Aina because I need to be punctual at 12 o'clock. I should be at another AGM meeting in KL. So that's why I take her slot earlier. So I hope you all had a good sleep last night. After stretching your vocal last night, you all pandai paksa nyanyi last session is last night. Okay, right. So my talk today on breast and cancer surgery, past, present, and future.
Show me the link of the share. Here you go.
How do I next? Okay. So as an introduction, breast and cancer surgery is one of the main subspecialties in general surgery. Everybody knows this, right? And breast and surgical cases causes up to 30% out of all general surgical cases. And why is that breast and surgery is categorized as another subspecialty? Because this is due to the technical nature of the operations of the breast and endocrine cases. And our cases usually associated with risk, a lot of risk, because you are operating in the neck as well as breast surgery. In the neck, you might be involved in all the major vessels or major structures, and breast surgeries, you may involve in another cosmetic surgery. So, as we all know that in Malaysia, we have so many complicated cases in breast and endocrine surgery cases. In the earlier years, breast and endocrine surgery was not a structured formal training program. It was not structured. So the pursuit of such training is not purely, was purely out of interest of any general surgeons at our local center. And the Ministry of Health sponsorship only mainly initiated by own personal interest and is very limited. So at the earlier years, it was not a structured formal program. And the history of our breast and endocrine surgical program dated back in 1996 to 1997, where Dato DG, our former DG, undertook the training as the first surgeon in the country to pursue it out of his own initiative in Sydney, Australia, in which he was trained under Rob Parking at Queen Elizabeth Hospital, Adelaide, for 6 months, and he continued another 6 months at the Royal North Shore Hospital, Sydney, under Dr. Leigh Dalglish. And when he came back in 1998, he set up a small unit in HKL, so-called breast and endocrine surgical unit, and Miss Aina was his first training, one-to-one coaching, even though it was still unstructured, but Miss Aina had a good privilege to be coached personally by him in HKL. And until 2002, there was a starting point by MOH so that BNE training program should be centered at Hospital Putrajaya. So this is the Queen Elizabeth Hospital where the country DG performed his training in Australia. Okay, now in Putrajaya Hospital Training Center, it was started as a 3 years structured MOS training program. And the applicant, it was actually dedicated for any general surgeon applicants working under the Ministry of Health. And the fellowship provides a unique training opportunity and aims to train a surgeon in a clinical care as well as operative management of patients with breast and endocrine diseases, including disorder of the thyroid, parathyroid, adrenals, as well as gastrointestinal neuroendocrine system. And the fellowship targets surgeons who are already engaged in academic pursuit of breast and endocrine surgery, as well as who will become an expert in this field. So from the previous years, a training program started in 2002, 2005. This is a program 2 years in and 1 year outside. And started with Miss Azlina, Miss Saroja, and Azlina. When I went to Putrajaya in 2005, the three of them were there in Putrajaya Hospital until Dato joined in 2005, and Miss Maya as well as Mr. Hussein and Miss Sarina. And finally, 2007, Ms. Wahana, Mr. Hisham, as well as Ms. Anita joined in Putrajaya. Is it correct, Ms. Anita? And Ms. Anita is the only one who's really loyal and still in Putrajaya now. Oh, yeah. Right. In HUKM Training Center, the first HUKM Training Center is the first university to have breast and endocrine training center in Malaysia. Now it is called Hospital Central Mukris or UKMMC. Somebody says UKMMC. And historically, it was initiated by Professor Priyamya, renowned first endocrine surgeon in Malaysia. And she has trained so many endocrine surgeons before, including Professor Rohiza, as well as Professor Shahrun. And sampai sekarang masih bertahan. Thank you very much. University of Malaya Training Center started successfully fellowship program which focused on breast surgery, and it was pioneered by Professor Emeritus Dr. Yi Cheng Ha, and subsequently succeeded by Professor Nur Aisha. He's still here in the room. And currently,
Everyone talk about
by Professor Sini, who currently focuses on breast and oncology surgery, as well as Ms. Sunita. Thank you very much for coming, Ms. Sunita. Although Ms. Prof now still in Korea, he's having global breast cancers conference. And our training concept is that we coach the trainees, we teach them, we transfer the knowledge to them, and we develop them to become a very good endocrine surgeons. From this learning process, they gain a lot of experience from the knowledge, from the clinical experience that they receive from us, and finally they will build up into an experience and skill endocrine or breast and endocrine surgeon later on. And our clinical-based learning program, including all about clinical work in the ward, clinic, operation theater, lab, radiology, etc. And of course, we emphasize on multidisciplinary team management, which include surgeons, endocrinologists, oncologists, radiologists, pathologists, anesthetists. And nowadays, the trend is we do everything via MDTs. And you've noticed that in your hospital nowadays, in 1 week, how many MDT sessions that you have been attending? I guess in Kota Baru, I think at least 10 MDTs that we have to join or we have to present yourself into the discussion. In all disciplines, they emphasize on MDTs. And we train all the trainees into operation on procedures that regards with thyroid surgery, parathyroid, adrenal, pancreatic, press as well as Angela surgery. And fourthly is the database question. This is what that we gained from in the learning process with DG previously when we were in Putrajaya Hospital from 2002 until now. I'm not sure whether any center is still doing this or not, but in Kota Baru, we still fill up our performance each time we have done our surgery. And we use the same template from Putrajaya since 2002 until now. The template now, the performance template has reached about 22 years until now. And we're still using the same template. And we usually attach the result of the finding at the end of the performance. And later on, we change the performer fitting into an Excel database. Usually it is done by our trainees in the certain center that they come. This is how the performer being filed in our hospital in Kota Baru. We have each year, so that it's easier for all the trainees to get everything and to do studies and to present studies. This is how Mr. Teo was with me before, and we got everything in house so that he presented and he published a paper in the World Journal of Advanced Surgery that day, and with the topics of anaphasic surgery, because we have everything. So means that I hope all the centers still using the same performer, using the same setting, using the same database. Even though the database is different, might be different from center to each center. Okay, local presentation, as Professor Shahrun mentioned just now, this local presentation that you should present, College of Surgeon annual meeting, MBESC, and any other local Malaysian surgical conferences, like Johor is having one somewhere in May, first to 5th May. So anybody has not yet presented to any local presentation, please enroll into this. Maybe you can try to get the organizer to accept your oral presentation. And we are having another local conference, Penang Surgical Symposium or MUGIS. This is you can just ask with the chair because it will be in Penang. And it will be in July. I'm not sure whether if you want to have oral presenters is still open or not. And internal presentation, the most common internal presentation that we used to attend previously when we were doing our fellowship program in Putrajaya before was Royal Australian College of Surgeon meeting, RACS. And the next RACS will be 6 to 10 May 2024. It will be next month. So those who are really keen to join RACS, you just can register yourself. I'm not sure whether it's still open or not, but you can always email them. Because maybe because previously this RACS conference is very popular in Malaysia. Until DG retired, there's no more stress on this. And next is Asian Association Endocrine Surgery Congress, ASAS. The next one will be next year in Seoul. I will give the brochure after this. And then Asia Pacific Breast Cancer Summit, in which was held last month in Bali. And the next one, International Surgical Week, which will be held in July in Kuala Lumpur. So I guess some of you may have registered yourself to enroll into this. And we also have Asia Pacific Society of Thyroid Surgery, APTS, and it will be a 2-yearly event, and the last year was held in Cochin, India. This is an example that I attended before when we were having a fellowship program during this time. Almost every year, most of the trainees during that time, we didn't miss this kind of congress. And we paid our own money. Not just, you just wait for AM to sponsor, or to get a sponsorship from Pharma. Kita dah tahu next year, the congress, The Congress will be in Australia. So kita simpan sikit for the registration. And usually we share the hotel or accommodation. So Perth, Christchurch, Beijing, Hong Kong, Brisbane, Tokyo, you see how many countries we have been traveling. So it's good. We have presented in all these kind of congresses, and until now, we still have a memory. And you can see the first picture down there is somebody, Tom Rees. Tom Rees is the one, the founder for Space of Rees in the Taiwan. So, this is where we met him in the RAS function. The third, Chinese Edition 2007, the picture down there, I was with Brian Lang. The Brian Lang is our renowned enterprise legend from Hong Kong. And this year, Kali are joining his center by this coming, is it July or January? Okay, research and publication is very important. So research and publication is a fundamental aspect of academics as well as scientific communities, and it plays a crucial role in advancing knowledge, disseminating research finding, and as of course it will foster intellectual growth. And this is in fact it's a medium for sharing latest scientific discoveries and theories. It has few primary goals. To contribute, I have to go very fast because I don't think to contribute to the existing body of knowledge in particular field, and as a researcher, we can add to collective understanding of the phenomena and processes, and therefore it will enhance the potential impact of the research and fostering the collaboration. This collaboration is very important. You need to collaborate. So whenever you know your friend, if you do research like this, so this research actually it was done by May Wong May Wan when she was with me in 2017. So we produced this paper in the World Journal of Surgery, and down there we put our correspondent authors. So until now, I still keep on receiving the email from all over the world to collaborate in any other aspect of thyroid diseases. So this is the thing that we have to emphasize. If you do research, you can just collaborate internationally because they will be always contacting you in what you are interested in. This is in 2006 when I did my fellowship 1 year in UK, in Newcastle. Masa itu tak saja. Sedikit And this is the hospital, nampak macam buruk dekat outside, tapi inside that's very nice. And during that time, okay, take this opportunity. The training, if you go abroad, don't just go and see or observe. You should do something. You have to write a papers. Contohnya, this is the surgeon. The surgeon is a journal produced by Royal College of Surgeons, Edinburgh and Hyde. When I was there, even though it's just a case report on primary squamous cell carcinoma of the thyroid gland, but the disease is extremely rare in the UK. So luckily, it was accepted to be published in the journal. Primary cell carcinoma. And during that time as well, we collaborate with all the centers. You see, Kota Baru, you collaborate with North Tyneside General Hospital, North Street, UK, Royal Infirmary, Hospital of Will, means that everywhere you go, you collaborate with them. And now you have your data or data sharing, and you can produce a paper. This is how you can create your own networking. So please do so. If you have time or you got time, please do so to collaborate with them whenever you go abroad. And the other journal that you can publish is British Journal of Surgery, and the most common for endocrine surgery is World Journal of Endocrine Surgery. Okay, what do we have now? We have about 53, we have altogether 53 endocrine surgeons in Malaysia, including universities. 22 are in KKM and 31 in Perth. In university, we have 10. all the universities,
After this, we have what?
USM,
Give to
UIT.
Then we got
And we have about
Then
21 trainees,
then we
10
need
are there, 10 of them are in first year, second year 6,
So
and
roughly
third
how
year
much
5.
for what? Go.
And the location, this is the location of
Technician
JKM BNE Surgeon in Malaysia, 13 BNE centers, and we have 9 centers with trainees, with trainers,
Oh, lama
and
lagi.
you can
Maybe
see
11
this
plus,
is all the
12,
3
11 plus.
centers
Tambah
that
lagi. Jangan lambat.
have trainers as well. And this is the trainers, where the place they are now. And these are all the trainers that, this is the picture that we do in our meeting with the. Next is patient navigation program. Patient navigation program is one of the national strategic plan in cancer control program from 2021 to 2025. And it was started in 2014 in Kashmir plan. And this is with collaboration with Cancer Research Foundation. Okay, this is what's the good things about to set up patient education program to improve the coordination of healthcare system, particularly in breast cancer patients. And we got an official letter from Ketua of Marah Kembangan, Dato Asman, in which they emphasize on doing this patient education program in all 10 centers that have breast endocrine surgeons. And this is official letter to support from our current DG, Dato Dr. Razir. And this is the project expansion 2023, 2025 of our patient education program. So far, we have 4 established patient education program center. We have independent staff in Kota Baru, and we are going to have MOU with MOH as well as Cancer Research Malaysia and Sultan Abdul Alim Kedah, Pemansuri Bainun by this year, and Hospital Kuala Lumpur as well. And the proposal for MOH to have this patient education program center, we have now about 54 surgical clinics, and we have 5 breast clinics with patient education program, where we would like to integrate this project to all 9 breast clinics under breast endocrine unit from last year until next year. We make sure that all these 9 breast centers have this kind of program. And later on, in 2 years' time, we want to integrate this patient education program into all 40 breast clinics under surgical units by another 2 years' time. And we would like to equip at least 2 breast cancer in each breast endocrine center. And surgery and technology advances, the advances of surgery include breast, non-composite surgery, minimally invasive technique for thyroid surgery, which include endoscopic thyroidectomy, robotic thyroid, transoral. I think we all well aware about this. And we have minimally invasive technique for adrenal surgery, which was popularized by Professor Martin Watts from Germany, that he first came in 2012 in Korea, when we had our first hands-on retroperitoneoscopic meeting during that time, or workshop. The evolution of breast surgery had come a long way from radical mastectomy, prostate procedure, until modified radical mastectomy, until we have now oncoplastic technique in order to preserve the breast cosmetically acceptable. And we have now minimally invasive technique such as endoscopic mastectomy, which is now being popularized by Professor Simi Hong as well as Prof. Sunita. And the breast surgeon, the breast endocrine training as well, we are trained them to perform our own immediate breast reconstruction, whether we use autologous reconstruction or using implant reconstruction. And of course, the more we be reducing the surgery procedures such as sentinel lymphodepsy, we are training all the trainees now. Okay, the latest technology used now is adjunct to thyroid surgery is a continuous intraoperative monitoring, which is initiated in Malaysia by Professor Rohita. He's being popularized this technique, and it was first trained by Professor Henning Grade from Germany. I think Miss Juliana, is it your center? Yeah, Miss Juliana was, I think, previously was with Professor Henning Grade in Germany. So I hope Miss Ju will do something on this to promote this usage of intraoperative monitoring. And the technique is accepted to disseminate to all centers with endocrine surgeries. Next is a BNE chapter. I hope all of us know we are now under the umbrella of Press and Enterprise chapter. It was first established in 2011 under the College of Surgeons. Our first meeting was in 2011. It was in Pullman Hotel in Kuching. It is in conjunction with Malaysian annual meeting College of Surgeons. The mission of this Press and Enterprise chapter is to provide an advanced subspecialty activities, both scientific and academic, and it will involve all the government surgeons, present time, universities, as well as biomedical surgeons. And the responsibility includes to organize conferences, posters, or pre-congress workshop as well. I hope there will be a list of names to join the workshop for ultrasound in the ISW next July. And of course, previously we have Malaysian Press and Enterprise surgical courses, which first initiated in 2012. It's a collaboration between IAS, BSI, and Business by University of Health. And during that time, we share knowledge, experience, and we brought all the presenters, all the speakers, renowned worldwide, and they came here to share experience. And so far, we have established or performed 7 MBSc courses from 2012 until 2019. And from this, they have already published into the journal about the support for our MBSc. And this is the last year MBSc which was held in Kuching by Ms. Adiba. And our future direction now is again strengthen your MBSc. Because BNE cases should be geared towards all the MDT, because the next is published program should be widely available and accessible to hospital. And from this, we should have an effective networking with other overseas centers. And embrace technology. How to embrace? Means that you need to have meetings, attending meeting conferences internally or internationally. And we are sending trainees, majority of them overseas, to embrace the technologies outside and bring back home. Okay, and robotic surgery has become an integral tool in many surgical specialties nowadays. Because dulu misalnya went to Korea to learn about robotic surgery in thyroid surgery, and it should be nowadays should be combined with AI to get a 3D, and we are moving into a new era for breast and surgery. So there are 3 important pillars to improve in the future. One is service. The service, now we have 13 BNE centers. We are expecting to open up another 7 centers in the next few years. Okay, Taiping, Kuala Krai, Temelloh, Seremban, Johor Bahru, HSA, Miri, as well as Sabah. So this is our ambition to open up another 7 centers. And research and publication, as I mentioned, and also previous talk by Prof. Shahrun, is very important. And training, we are going to recruit more trainers as well as trainees. We open up more training center. We try as much as possible with technology as well as with each center with our own ultrasound machine as well as our machine. Finally, the summary, to have a very successful BNE study submitted, we should have a comprehensive team members or team care, and we should continue specialized care, that they are equipped with all the needs to care our patients at this point, and we need to have a very quality services in which the trainer should have a very good knowledge and a very good skill, and of course advanced technology facilitate all the centers should by ensuring our precise and successful interventions done to our patients. And research and development, again and again, research and development and cooperation with all the teamwork and collaboration. This is all that we need to do in the next future to make sure we get everything in house. Thank you very much. Again, this is the program for ASAS, which we have next year at the Local World Seoul, Korea, April 2025. I hope you will enroll in this because I am the secretary for ASAS. Please enroll. Thank you.
Tak apa, thank you Dato. What was the come, gini. Tak.
So, I would like to invite, Prof. Shahrun, to give a tour of the situation for the BNE.
Untuk ini tak dengar. Atas lah, bos, atas lah.
Boleh. Ada masalah. Driver datang ambil sebelah. Boleh.
Mic, mana mic?
Okay,
Tak, salah dulu.
thank you so much, Dato. That was a fantastic presentation from start to finish. I think we can see the big hand to the meet. Yeah, I'm retiring next year, therefore I will just say whatever I think I should say now. I think the breast and endocrine fertility has grown so much. Congratulations, I think the training and the fellowship that you have with each other is actually very exemplary. Not many fertility will be comfortable and happy as we are. Okay, so we have to be thankful that we have this very good group of people. But my comment would be the national issue that we have in the country is about breast diseases. I feel the breast endocrine fellowship has actually diluted the attention on breast cancer management. I can see it might be a Freudian slip on Dato' Imi's side, but I've been in this fraternity for so long to know that endocrine surgery seems to be the priority and the breast management seems to be the secondary effect. I mean, it's fantastic. I love endocrine surgery. I like the academic side of it. But when I'm working, I know that my patient volume is actually on the breast side. So I congratulate that you're doing the BNE program. These are all going to be change makers. It's definitely going to improve the care. But I would say let's also give a bigger attention to breast training, because again, I can see from the case discussion yesterday, I think we're not doing very well. Honestly, if you guys are going to be the breast surgeons out there, I fear for the patient safety. Okay, so I would say if you're going to do any seminars, you have to put in more time for breast training. You have to, because if not, majority of patients are not going to benefit from this very wonderful fraternity. You have a lot more potential to actually increase the bar for breast cancer management of the patients. So itu je lah Dato' Amy. Sorry lah, I just have to say this because I've been in the fraternity for so long, and I think I'm not a forceful person. I'm actually a very kind, compassionate, collaborative. Tapi I think at this point in time, when I'm retiring, I hope that you guys will actually put more attention on the breast management, which is actually for patients. You know, what's the most common cancer in Malaysia? Not only about just women, it's breast cancer. Potentially, you can save so much more women out there and men as well. Okay, thank you.
Thank you, Prof. Shahrun, for the comment and the compliment as well. And in fact, thank you very much for joining this program until the very first day until now. And thank you as well, Prof. Smiza, for coming here, despite sometimes you have to listen to all the endocrine lectures. Tapi tak apalah, it's a knowledge, right? And regarding the breast cancer or breast trainees, initially mungkin kita kena improve on that. Thank you for the comment. Mungkin the organizer, Prof. Shahrun, please take note, or anybody else who are organizing next year onward, the same program should be balanced between breast diseases as well as endocrine diseases. Means that mungkin one day for breast, one day for endocrine. Mungkin Prof. Shahrun rasa macam the discussion on breast tu terlalu limited. Is it correct? Yes. Okay, so thank you. We take note on that. Correct. Any other questions? Bila Prof. Shahrun nak tanya? It sounds like very soon.
My birthday is September next year.
Or next year. Okay. So 1 year more. comments on this before we shall pass back to the MC.
Thank you, Amy, for joining us throughout the whole 3 days, all the way from London. Right, so the next, we will proceed with Ms. Aina's talk on what it takes to be a good trainee, perspective view from a senior trainee.
Thank you.
They are saving the best for the last, it? Right. Okay. Assalamualaikum and very good morning. First of all, I would like to thank the organizer for inviting me. I'm actually almost out of the fraternity already because I've already retired. You're joining us soon. But anyway, I think part of my talk already been highlighted by Prof. Shahrun as well as Dato regarding the trainees. So I just hope fellow trainees don't feel yourself suddenly being imbued by so many expectations. It's not like a heavy burden or a stone put upon you, but basically just we try to highlight because I'm a trainee as well. I was a trainee before as well. It's it's one-on-one is even worse actually. Okay, never mind. We move on. Right, I think almost overlap our lectures a bit on strategy training itself, but I think it's already highlighted by Dato earlier, so I skipped this one, as well as the training program itself. Also, I skipped this one. And I think a very balanced discussion by Dato just now, both on KKM side, Ministry of Health, as well as part of university. And in fact, now we have more trainees coming from other universities. Like, for example, from USM, we already have a trainer there, Ms. Maya, and our Mr. Niamin, hopefully you're successful, all the best. And later on in futures, become a trainer for EMS. So the more people coming in the fraternity will have recruit and strengthen the fraternity. Though I know very well, orang kata patah tumbuh hilang berganti kan. As many as people coming in, twice as many people leaving, unfortunately. Okay, right. So how we choose the trainees, I think being highlighted before. So I think who are being trained before, that the system by KKM is a bit different from the Ministry of Education. I think Ministry of Education more on one-to-one basis and more on each individual university. But KKM, we have a generic process because it involves other sub as well. For example, colorectal fellowship, upper GI, as well as vascular trainees. And as we are part of our general surgical services. So I wouldn't highlight that more. Just basically, we will receive application from a general surgeon, a qualified general surgeon. There will be an interview by panel of BNE trainers. I was meant to understand this time interview was a combined effort from MOH as well as university, which is very good actually. Because last time we have separate, the MOH, we have their different interview session as compared to now, which is a progress for me. And after we interview, actually at one time, we hardly can choose because we need people. So even the rotten apples we have to take in. But please, even the rotten apples, we groom them become a golden eggs, okay? So that's a compliment to the training program. All right, and final selections, I think I'm sure some of your colleagues tried to apply but couldn't get through because again, based on the head of services of the surgical, not Dato head of the surgery itself. Now is right. So because Ministry of Health has to look into the need of the service, that comes first before the training. So by having you or the general surgeon into the training program, that will deprive the service of certain hospital So unfortunately, your application will be deferred and you have to reapply again the following intake. And at one time, you want to take 2 intake, like July and early January or February. But again, they realized that it's too much taxing to the services. Because those in the services, especially even BNE plus the general surgeon, are leaving. So it's actually, it leaves a bit of unfairness to you guys who are aspired to become a subspecialty training, but unfortunately you are bogged down to stay back in your respective hospital because no one else left to run the service as it is. Okay, so you've been selected as a trainee program. Congratulations. And told, or basically we received a letter of posting where you will be. Quite a number of you will be staying in the same place of your training center, because usually the hospital already have the BNE centers. For example, if you're coming from KB, you stay for KB, coming from HKL, but some of you will be moved around. Depends on the, again, placement, and this will be decided by our trainers committee. So the question now, what it takes to be a good trainee? There are a few important points. First of all, please remember, you are a general surgeon first, then trainee number 2, okay? Not the other way around. So you are expected to perform and function as, the word is competent general surgeon. So wherever you go, the general surgical service is still there. So please be aware. Some centers may have very specialized services, so much so that a lot of breast endocrine works, but some the breast endocrine work, for example, in KT, isn't it? A lot of general works coming in rather than breast endocrine work. So because of that, there's some kind of balancing act need to be performed. But for the trainees or the future trainees, please remember that you are first of all a general surgeon, okay? Then you become trainee, and you cannot forgo your role. I mean, you still have to run bread and butter services of being a general surgeon, all right? And another concept must remember, being a breast endocrine trainee does not mean you are any better or superior than the non-trainee surgical. You have to do on-call, you have to do on-call, you have to do all the scope, emergency procedures, you have to do it. You have to do laparotomy early in the morning, you have to do laparotomy in the morning, okay? So there's no exemption. Just because you're a breast endocrine trainee, you have been privileged. Nothing is, not of such thing, right? So what are qualities expected as a trainee? I think some will already be highlighted again by the previous presenters. Okay. For example, we want, among the quality that we look for, enthusiasm. Tak naklah trainee yang lembik, yang malas-malas, macam nak tak nak. You must show your passionate, your interest. You really want to be a sub, be it in breast endocrine or in the breast surgery itself. Yeah. And of course, next criteria is hardworking. We like, I mean, attitude, character is one thing, but hardworking is, of course, is number one aspect that we want to look into. And the third criteria is able to work in a team. I think Mr. Hakim already emphasized a lot of it as well. It's very important. You do not work in silos. Teamwork is very important. You have to be actively involved and become a supporting member of the team. So please do not just receive order from this particular trainer, and that's all you do. You don't care about the rest of the member of the fraternity in your working space. So for example, you're in training centers, in a big training center, for example, in the HKL, you have other subs, isn't it? You have colorectal, you have upper GI, you have vascular. Doesn't mean you are BNE trainee, you are only considered unit. No. At times you are called to work for the other unit as well, because we work as a team in the department of general surgery. So please remember that. So you do not ignore others. You must be able to work with other colleagues, both your fellow trainees as well as non-trainees, and senior colleagues, subordinates, your medical officer and houseman and other health staff, namely the nurses and all. So if you are a team player, that's very, very good asset first. So you need to have that such interpretation skills are very important. Next, we want to see in our training leadership skills, some kind of leadership, which I think is already emphasized during your master program as well, isn't it? So you cannot wait to be told what to do. Okay, there are certain things in the department that you should take initiative to do it. I mean, you can always go, Mr. Hakim, can we do this, something like that. You wait until Mr. Hakim message, okay, now do this, Theo do this. I mean, come on, you are all adult already, okay? So there are things that you want, because for me, when Mr. Hakim was with me, he was not even a trainee with me at that time, but I would have a good time because he knows what to do already. He proactively decide what things to be done. Just he has to tell me, okay, I would like to do this. So we want to see that in training. This kind of quality need to be shown. Okay. And of course, despite we allow you to do things that you want to do, you must know your limit. You must aware what are your weaknesses. You need to acknowledge your gaps in your knowledge, in the skills, and how would that going to affect the management. I'm not sure. As I go through for this particular, as preparing for this particular talk, I met this particular they call this Dunning-Kruger effect. And it's a cognitive bias in which people with low abilities overestimate their abilities, but those with high abilities underestimate them. So what happened then? Okay, see what happened then. If you overestimate your abilities, you think, oh, I know this, don't worry, you need to call the consultant, I can handle this. So what happened? You may take actions without consulting the senior colleagues. You may take matters into your own hands and end up having a wrong judgment on patient and resulting in morbidity and complication of patient management is terrible, can lead to medical legal issues. On the other hand, you actually could, but you're so scared to take action. This one I can see Shahrun so geram kadang-kadang. You can do it, but you're so scared to take decision. Also, we don't want this. That's why we don't want you to be told what to do. There are things that you can take initiative. So you're afraid to act upon things. You slow, you cannot make decision at all. You know what's supposed to be done, but you're so scared to take decision. You wait for a senior colleague or even your trainer or something to decide. So in the end of the day, nothing gets done also. So you need to have balanced perspective and know your limit. Okay. Next, okay, I think I don't want to emphasize more. It's already highlighted by Prof. Shahrun. You need to read widely. You need to read and read. And you're a medical student, you can read a lot. Once you become masters, you read less. Sometimes even read even less. No, you should read more actually, because you need to master in depth. In medical student, it's the breadth of the knowledge, isn't it? But in a subspecialty is the depth of the knowledge. You have to dig further and further. So you need to sacrifice a bit on trying to get subscribed to online journals, but you're under, I think, because being master student, you're under university, isn't it? So you get access to international online journals easily. But once you become a surgeon, you're on your own, and not every hospital have their own online journal. I think some hospitals do have. You can go to the library and they have the online journal, but you need, because you need to increase the knowledge. And of course, by attending conferences, seminars like this, and yeah, willing to spend money to acquire knowledge. You have to buy it lah. Because you mentioned like RSCS, that you mentioned 2005. I attended in 2000. Luckily, I was doing my fellowship in Adelaide, so okay lah. RSCS were in Melbourne, so you have to pay lah, which is good for me. But sometimes RSCS may be on, like for example, you're in KL here, you have to travel all the way to Australia. But basically, trying to say that you need to do some sacrifices as well, in terms of your own pocket money to increase your knowledge. Next is what sort of skills that need to be done. I think I'm glad to see a new format of training, which is more objective. A lot of assessment during the training itself, so that you can catch which part of your weaknesses, the trainee's weaknesses, before it gets too late. Okay. So you need to learn new skills related to breast and endocrine surgical procedures, and nothing beats doing case more. So you usually have to scrub more cases, either as assistant, maybe run of the cases, you can do it on your own, right? And you need to keep logbook. I want to mention the logbook already highlighted just now by Prof. Shahrun. Okay. And this way, I say you have to aware your own weaknesses. In fact, I want to ask Prof. Shahrun this question, because you have that sets of numbers of procedures you need to perform under supervision and to be on your own. But I think the supervisor word to the trainers, you need to assess your candidate as well, or your trainees. After doing 10 procedures, do you think he or she competent enough to do on her own? Because learning curve for each is different. Some people after 3 cases, they can do everything already. But some trainees, even after 20 cases, they still cannot perform the procedure. So this one has to be individualized. But you, as a trainee, you have to be aware on yourself. You realize that after 3 cases, I still couldn't make head of tails of things. I need to assist more. Then volunteer yourself. Like for example, if you come to HKL, you got Mr. Hakim, you got Mr. Raflis, you got Miss Azia now. So just come in for it. I know it's very tiring. You cannot just say, oh, I want to attend Mr. Hakim OT only. No, cannot. You have to attend as many cases as possible. Right. So it's something that as trainee, you have to be aware. And as trainer, of course, you need to monitor your own training, how they perform. Okay, next, critical thinking skills. We can emphasize more again, mentioning that you need to have that good clinical judgment, problem-solving ability, and decision-making skills. And again, by doing more cases, by reading more articles, more case discussion, and play active roles in patient management. It is again, interestingly, and I'm happy to know that this will be highlighted in your next coming new training program. Because admittedly, yes, we do realize that during exit exam, this is one of the weakest link that happened among our candidates. They just couldn't think and decide what happened. Okay, sorry. So clinical judgment is important. Okay, you can see from this diagram, critical thinking skill involve a lot of reasoning, problem solving, evaluating, decision making, analyzing, right? Okay. I already mentioned it just now, lacking skills to not able to make sound decision and case scenarios presented to exam, right? Already mentioned. And of course, you need to hone your public speaking skill because of the presentation at local international level. Again, thankfully already highlighted by Dato and Prof. Shahrun. Okay. This is part of like again your research and publication. What I want to highlight, you cannot make this an excuses. Like you can say that I'm overloaded with works, services that you have no time to research. No, you need to find time. You have to really find time to do it. And already discussed, even Prof. Nani and Prof. Asha mentioned, and there are many ways of trying to do research as well. And it's good if we have some kind of collaborative study between ministry and the university if there are such studies. But it's part of the essential requirement for training to do this. Okay, and yes, presentation, be it at local conference, international conferences. So when you actually, if you feel to pay your pocket money to go and attend the conference, we have to pay the flight, accommodation. If the place where you are attached now, for example, you're in Japan, or for example, Ms. Azia showed just now in Turkey, and you have some national conference that particular level, just go and attend. I think the cost is cheaper because you don't have to pay much in terms of flight and everything. But please make yourself try to attend. The best is you attend breast and conference, in general conferences. Okay, so that basically describe the rest of the presentation. What is needed to be. Okay, next, I just want to highlight a little bit about EQ. I think you've heard this before. I would expect that all trainees must have high EQ. Okay, you need to have that ability to understand, use, and manage your own emotion in positive ways. All right. Okay, to relieve stress, communicate. Those people with good EQ or high EQ, they can take things better. They can absorb the stress-related work-related stress better. And I think among trainers and us also need to have high EQ because it's stressful when we have trainees like this, credit like this, right? I think it's something that is more like psychological or psychosocial aspect, but it's something that I think is good to have you to look into this and need to hone, because EQ is something that you can learn and you can hire actually. If you have low EQ, there's actually, if you read about the method, they are like objective assessment where you want to position yourself, and then maybe there are things that are going to improve your issues. Because a good EQ, you can make a good decision making, you have good interpersonal skills, and you have better insights. So you know where your weaknesses is, you know where you need to improve, you need to pull up to enhance your gaps rather than, I mean, orang kata membuta tuli, jalan, dia tak tahu benda yang salah kat yourself. No, we don't want that, okay? Right. A bit on challenges issued with trainees, again, highlighted that before you enroll into the program, you have to make some preparation yourself. If you're not ready to go, maybe you need to defer and you wait for them. Because we don't want things to come in and disturb and disrupt your training. But of course, unfortunately, you'll get pregnant and childbirth. We don't ban you from being pregnant. We've got trainees got pregnant once. Even the former trainer also got pregnant. But don't let this as an excuse for your poor performance. right? I sorry to quote our Miss Azia, she's got pregnant, she got delivery, but she can still get through things, right? And then we already set the boundaries in how long you need to defer your training program and all those things. Okay, but these are the issues that I know that something is part, because when you're a medical student, you don't involve family matters that much. But once you become a surgeon, and especially if you're being the only doctor in the family, I don't ask you to neglect your duty, your responsibility to your families. You need to highlight that as well. But you need to balance yourself, whichever you can do, to make sure your training program not disrupted at all. For example, logistic issues, when you are away from family, you have to rent places, again, taxing on your financial burden as well. So these are the things that as your future trainee, you have to consider. But this shouldn't discourage you guys from not joining President Plan training program. Okay, I think we did the repetition. Yes. And workplace issues as well. We have, I mean, if you feel you are the first trainee causing problem, no. I have had trainees that said, oh, Miss Aina, I cannot be in that hospital. Why? I got some issue in that hospital. Then where you want to go? I want to be in that hospital. I mean, there are those, and if we can accommodate, we try, but sometimes we can't. So unfortunately, you just have to take it, because if you really want to be a president of the country, you should take everything that fall upon you and try to work things out, rather than asking the trainer or the ministry, can I change my place of posting? Because I think for ministry trainee, you are giving 1 year for each place, right? Because you have too short, with all those assessments coming in, sometimes you don't have enough time to do all those needed assessment. Okay, and yeah, they got problem with working colleagues. You may have friction with fellow trainees. That's why I say if you have a good EQ, you don't have this problem actually. It takes a long time to adapt to the new environment and different expectation. The third part said, oh, masa I kat KBE, Dato ini okey je, benda tak ada masalah. Datang sini Mr. Hakim tak okey pula. I just quote because from my own personal experience. The trainee come to me and said, when I was in KB, macam okay je. But the same thing, when she's back in HKL, it's not permissible. So I said, no. Because remember again, when you're in KB, you're first year pun kita bagi kesian like said, but now you're in the year, come on, you have to perform better. Right? So, just telling you guys, you need to change, we also need to change, but change for the better. You cannot expect the things as similar as what you had before, right? And at the end of the day, the most important thing is, as trainee, you need to focus on the training itself and find ways to resolve whatever issues that come in your way affecting your training. And as mentioned by Prof. Shahrun, you can request to defer, even you can request to drop out, but remember for KKM trainees, you are binded into a contract. And if you want to opt out from training program, you may have to pay a penalty for that. Okay. Right. So in conclusion, please feel yourself when you're selected. It is a privilege. It is an honor to be in the program. Okay. You need to take that pride in. I like to see that. Prof. said you have to get some pride in yourself. Okay. And you need to strive to perform and fulfill whatever requirement needed for the program. Presentation ke, kursus ke, apa-apa, you just go through and have to fulfill that. At least you are being aware up front, isn't it? What needs to be done. When we were doing unstructured program, we do not know. Suddenly, next day, Tan Sri said, okay, Aina, we got conference next week. Prepare presentation. You're on call, you got things to do, and just prepare. At least you have things now. We got that film coming up even better, right? Right. No such thing as perfect trainee, as there's such thing as perfect trainer. Okay. We have our own issues and shortcomings, but we expect trainees to try to work to overcome that shortcoming and weaknesses and enhance your strength. And please, no matter how stringent, how stern, and how garang your trainers is, actually they have very golden heart. They want to help you guys. Okay. So if you have established a good rapport from the very upstart, it's so much easier for you to talk things out with a problem rather than you don't talk. You're incommunicado trainer, which is bad actually. Okay? Bukan nak suruh you belanja, beli kopi hari-hari lah kat you punya trainer, tak payah. Tapi I mean, come on, like, there's a human touch, right? You need to find ways and means to get into the heart of your trainer, okay? Right. So because your trainer will help you a lot. Okay. And of course, as trainer, we still have to assess you guys objectively. No matter how gula-gula you bagi kat kita orang pun, kalau you are bad, I'm sorry to say you are still bad. You can't perform, you can't perform. Okay. So you, I think maybe we have to say, kenalah buat seikhlas hati. Okay. Right. Right. Okay. I think I conclude my talk. I hope some good advices given. And okay, for the GSWI fellows, please don't feel yourself being left out. We welcome you guys as usual. And I think you, as far as Ministry of Health Services are concerned, your contribution are really, really, really appreciated. In fact, we hope you become ambassadors to encourage other young students to join the fraternity. Because some of them, not that they don't want to be a fellow, but as I mentioned, they have family commitment, they have other issues that refrain them from joining fellowship, but they still have breast endocrine at their heart, which is, I thank them for that. Okay, that's all. Thank you.
Thank you, Miss Aina. If Miss any Q&A for Miss Aina? Okay. I would like to invite Miss Aina to the center of stage and for the Prof. Shahrun to give a bit of a token of appreciation. For your stage. Next will be Prof. Nur Aisha, Binti Muhammad Dain. Thank you so much. Followed by Prof. Dr. Sunisa, Binti Jamaris. Budak ni salah nombor. Nama salah. And then Dr. Siniza. And then Miss Anita. Miss Anita is not around. Mr. Hakim. And Mr. Hafiz. So. And last but not least, Prof. Nani. Thank you to all of our speakers. Next, for our closing ceremony, we have a little bit of video, and then after that, all of us can go and check out. Okay? All right. Apa dia?
Prof, sana.
Miss Alina tak ada dah, dia balik.
Dah balik.
Miss Alina dah tak balik dah. Miss Alina dah tak ada dah nampak. Ada. Dah balik dah. Miss Alina. Okay.
Kejap, misalnya.
Siapa ni kan?
Link. Tak, unmute your laptop.
Sebab tak ada suara sekejap. Macam mana nak ni? Tak, ini suara tak ada. Saya nak pula.
Oh, it's not mute.
Okay.
Now
Dah,
it's
dah.
mute. Oh, fuck, can't see.
Saya nak-
Tak apa. I can't attach.
Kau takkan pernah putus asa, akan ku melangkah hingga ke ujung dunia. Belum jauh ku melangkah, belum jauh ku berserah, masih banyak yang ku pikirkan, masih banyak yang ku inginkan. Ingin aku merasanya, ingin aku mencoba, hampir ku kecundang olehnya, hingga ku menangis kecewa. Ku takkan pernah putus asa, akan ku melangkah hingga ke ujung dunia. Ingin aku merasanya, ingin aku mencoba, hampir ku kecundang olehnya, hingga ku menangis kecewa. Ku takkan pernah putus asa,
Okay. Dah, dah.
Kenapa? Okay, I think it comes to the ends, right? So on behalf of the committee, I think majlis ini takkan berjaya with the great support from these fellows, right? Please give a round of applause, especially headed by Mr. Adi, Zillian, so Fatah, and also the admin. The admin pun juga kat Sabah, dia tolong cari sponsorship. So this is a good asset for our ni lah, for BNE. Right. So any other macam apa-apa program memang akan ada shortcoming. I ucapkan minta maaf jika ada kekurangan. Okay, I know there is a few comments. And with these comments will be given to the next host. So the next host kat mana? So kita dah, I think ada cakap bisik-bisik ke Dato Imi, the next host will be Melaka. So tolong bagi mic kat orang Melaka, apa dia komen? Any comments you want to give?
Bismillahirrahmanirrahim. Alhamdulillah, dapat pertama lah sebab saya rasa salah satu penghormatan juga kalau diberi peluang untuk next year dilakukan di Melaka. Jadi terima kasih juga kepada organizing committee kali ini kerana memberi kepercayaan for the next year to be done in Malacca, insyaAllah. Dan of course, I will think it positively because knowledge is power. Yeah? And then if we apply the knowledge, it become more powerful. So to organize the distribution or the sharing of knowledge, more power, more and more power. So thanks. Inshallah.
Right, okay, akhir sekali saya ucapkan terima kasih. Harap the objective for BFS telah tertunai dan tercapai. Okay, please have a safe trip back to your states, your hospital. Assalamualaikum warahmatullahi wabarakatuh. See you back in Melaka. Okay, thank you very much.
Ada request from Miss Aina dan gambar dengan the speakers. Thank you.